Hi, everyone. My name is Jenny Mae Harms. I'm the Development Director for KOSU Public Radio. We're so glad to have each and every one of you joining us today for this edition of Inside KOSU. Today, we're going to be joined by KOSU reporter Kateleigh Mills, along with StateImpact Oklahoma's health reporter Catherine Sweeney. This is a conversation that we knew needed to take place because after speaking with so many of our members across the state, I personally kept hearing from more and more of our members saying, how do we get our vaccines? What do we do? How do we get the booster? What's a pod? Just all of these questions that I know our reporters have the answers to or want to get the answers for you. And so we're going to have that conversation today. If you have any questions during this conversation, please submit those through the question function. There's also a chat function. We'll be monitoring that as well. If you're having any problems with the Zoom, please let us know. Both Myriad Todd, KOSU's membership director, as well as KOSU's intern, Chelsea Stanfield, will be monitoring those on the back end. Yeah, they'll also be posting some helpful links during the chat or during this conversation in there. So watch for that. And without any further waiting, here is Kateleigh Mills and Catherine Sweeney. Thank you so much for joining us.
Thank you, Jenny Mae. Okay, so just to get started, we wanted to go in and talk about some of the common questions that we get like in our inbox, we get through the KOSU texting club, on Twitter, on social. And one of the first questions that we get is really simple. It's, what is this Oklahoma vaccine scheduler portal that we hear about? So that is a resource that was created by the Oklahoma State Department of Health. It's an online sign up and questionnaire where it'll tell you what phase in the state's 4-phased plan that you're in. We're still only vaccinating phase 1 groups and 3 groups in phase 2. Those are first responders, healthcare workers outside hospital settings, and 65 plus. And you can find that at vaccinate.oklahoma.gov. Another question, I'm going to toss it to Catherine, that we get a lot as well. What are the other ways to schedule a COVID-19 vaccine appointment besides using the state scheduler?
All right, well, that question is jumping the gun a little bit in some ways because we do not have a lot of supply yet. So in the future, you'll be able to talk to your primary care provider or call a pharmacy. There will be other, vaccination clinics presented by, providers, but that's just, we're not there yet. So right now it's mostly just the vaccine portal. If you don't have internet access or you're trying to help somebody who doesn't, you can call 211. That is a little bit tough, but the hope is that you get through to 211 at some point. There's been a lot of wait, but then once you get to 211, they will compile a list and get that list of names to like the state health department or your county health department, and then they will contact you to help you set up an appointment. Right now, it's really just those, and it's looking like ME Labs in Norman is doing a vaccine clinic for people 65 and up. Oklahoma did opt into the federal retail pharmacy program, so Walmart pharmacies and a few others will be doing vaccines for people 65 and older, but they are not really taking appointments yet. So again, there will be more options in the weeks and months to come, but right now it's mostly just 211 and the vaccine portal online.
I do want to talk about this as well. Jenny Mae kind of hinted at it, but what is pods? And can you talk about the reporting that you recently did about the maybe megapod that people might have been hearing about?
So pod is actually an acronym. I know it's a real word too, but it's an acronym for points of dispensing. They're basically vaccine clinics. And so there have been pods that have been put on by special organizations. There have been pods put on by counties, but basically they're just sites where people are putting vaccines out. They can be day long, or they could be weeks long, months long. They could be regular or just for special occasions, but it means points of dispensing. So that's mostly just, right now, the State Department of Health, county departments of health, and their partners like United Way. We're going to start seeing, hopefully, something called a megapod in some of our more urban counties. Oklahoma County announced last week, the Oklahoma City County Department of Health announced that they're working with the State Department of Health and also the National Guard and the White House to develop these big, like, mass vaccination sites called megapods, which sounds like something out of a sci-fi movie, but they're hoping that they will be able to vaccinate about 6,000 people a day at those sites, and it would be 6 or 7 days a week, which would be a huge help. And one of the best pieces of news coming out of that is that it would not take away from the state's existing allocation. It would be a new stream of vaccine supplies. So that 35,000 a week or whatever would not be coming out of our weekly allotment to the state.
And I do want to talk a little bit about that federal pharmacy program you mentioned too. So what we know from that is that it is beginning this week, and it's just an initial 73 pharmacies that are going to be splitting more than 11,000 vaccines. And I think it's important to note with this program starting that it's not going to be something right away where you can call a pharmacy and get scheduled like right away. Because if you think about it, and when I talked to the pharmacy providers of Oklahoma, they told me that you got to keep in mind that a lot of these pharmacies have been getting calls from the people that they already serve, right? So I think it's great news that this program has been announced, but it's good to know that there might be a waiting list when you call your pharmacy that you trust. So I just wanted to put that out there. And so another one we get all the time is, why is it so hard to get an appointment for current eligible groups on the scheduler? And I think that the thing that Catherine and I hear all the time in the state meetings is that the appointments are based on vaccine availability. And the state's FAQ page says, whenever you sign up and you are eligible, that you'll receive an email with a direct link that's unique to you to schedule your appointment. And then they've also told us that like the best time to look for an appointments are Wednesday afternoons and Thursday mornings. And then that it's just like good to check back all the time. But we know that people can't like spend their whole day just refreshing and refreshing. But Catherine, I don't know if you want to say anything about that as well, like why it's so difficult.
I think that one thing that is not incredibly obvious, but really is a big factor in why this is so difficult, is that the state gets its update on how many doses it's getting only week by week. So the federal government doesn't say, the first week of February, you're getting X thousand. The second week of February, you're getting X thousand. The third week, you're getting this many thousand. If they did that, it would be a lot easier because the state is only booking appointments a week out because they don't know how many vaccines they're getting the next week. It could go up, it could go down. They don't want to set up appointments and then not have the supply. So the max possible appointments are only what they can do for a week. If they were doing it a month out, there would be 4 times as many appointment slots available. But because of the way that the feds are allotting the vaccines and the way that they're notifying the state, they can only do a week's worth of appointments at a time. And that's pretty tough. I think that a lot of people, if you could say, oh, I'm going to get on there and I'll book an appointment for 2.5 weeks from now, again, there would be so much more availability than there is right now. And so that's really dependent on the feds. Well, I guess Oklahoma could do that, right? They could take the risk of booking appointments and then not having the supply. We've seen in other states that they had to cancel people's appointments because the federal supply wasn't what they were expecting it to be. And Oklahoma doesn't want to get people's hopes up for a vaccine if they end up having to cancel that appointment. So it is pretty inconvenient. I know my own family, people over 65 have been really struggling to get their shot. I know it's tough, but this is a tough problem to try to fix. And just last thing on that, Oklahoma health officials have been working on plans for mass vaccinations for a really long time. That's kind of like, this is their Super Bowl, right? This is what they're hoping for. Oh, not hoping for, but planning for. This is like the biggest event for them. But that being said, they have the plans, but they don't really have as much infrastructure. We haven't been funding our public health departments the way that like we could be. We don't have like the workforce in place that makes this easy. There's just not as much like manpower and like, physical infrastructure, places to do this. They're using community partners, but it's not like we just have vaccine sites and vaccine workers waiting in the wings. We're having to really build this from the ground up, and we just started in late December. So it's been tough, not to minimize the headaches that some of our seniors have been having to deal with, but it's a tough effort too.
Yeah, I know that one thing that a lot of people were texting in about was that they've already had their first, but they're still having like issues scheduling their second. But then I know that whenever we were in that state meeting, that a lot of other media organizations brought up that a lot of their readers or listeners or whoever watchers were bringing that up as well. And one thing that the state did was make clinics or pods just boost only appointments. And they told us that those are clearly marked on the scheduler, but if for some reason they're not, please let us know and we'll look into that as well. I do want to ask you, Catherine, you kind of mentioned it, but how is the state faring compared to other states?
As irritating as it's been for a lot of people, Oklahoma is actually doing a lot better than most other states. They've stayed in about the top 10 for the proportion of vaccine eligible adults getting their vaccines. We hit 10% pretty early, sooner than other states. I think we were 7th when that happened. So the reason it's for people who are eligible, this is mostly just for people over 16. It's at the proportion of the population. They're saying it the adult population. Children were not included in the trials. So that's just adults. But some of that is because in the early days, Oklahoma was getting a proportionately higher amount of vaccine supply than a lot of other states, but some of it has been some of the policies that Oklahoma has implemented. I did some reporting on this. Other states were very rigid about their phases. They said, we are not going to vaccinate anyone else until we get all of our healthcare workers done. And then we're not going to vaccinate anyone else until we get all of our responders or first responders done. And other than with the 65 group, Oklahoma has been making their phases pretty fluid so that they can get their vaccine out as quickly as they can. Part of that is Oklahoma, like every other state, has to prove to the feds we need more supply. And if they have a bunch of vaccine doses sitting in freezers, it's pretty hard to sell the feds on, we need more, we need more. And so Oklahoma has been really trying to get through its vaccines as quickly as possible. And sometimes even, if there's 20 doses left and they're going to go bad in an hour, Oklahoma's allowed to break away from their phases for that and vaccinate other people. That's been a little controversial because some people feel like, oh, well, then people are jumping ahead in line. It's not fair. But the state health department would tell you, or the health officials would tell you, whenever somebody gets their vaccine, they're not just protecting themselves, it's also aiding the community and cutting down on community spread. So it's also helping cut down on cases. And I know that doesn't seem super obvious, but the more people who are vaccinated, the more cases will go down just in general. And so we need to get the vaccine out. Their philosophy is we need to get as much out as we can quickly, not just for personal protection, but for community protection as well.
Yes. I do want to remind people that you can submit the questions that you have as we go into the Q&A window, and that's located on the bottom, should be right-hand screen. It's like two little comment boxes next to each other. And so let's go into the next thing that we get a lot, especially now recently. It's the idea of like, when are the next phases going to be added? Teachers, people of any age with comorbidities. And as of right now, and it continues to be this way usually, and anytime it's brought up, because it's brought up every single time in the state meeting, when's the next phase going to open? Do you have a timeline? And as of now, there's no timeline given to us for the rest of phase 2 by the State Department of Health, including people of any age with comorbidities. But then there was also a question brought up where it was like, how are they even going to define that? Is it going to be kind of an honor system kind of thing? Are people going to have to get doctor's notes before that? So I think that's something that we're watching because it hasn't been very clear to us yet. But I think that there's one thing that was said that health officials said where they're leery of opening it up because they're trying to get that large percentage of 65 plus vaccinated. And so can you talk a little bit about why that is, like why that population is being so focused on?
For sure. So there are two main reasons that the state is really trying to prioritize 65 plus. And by doing that, limiting it to other populations. The first is people who are over 65 are the most likely to fare poorly if they do get infected. And the second is that they can struggle with this technology more than some other populations. And they've really said, we do not want to create a situation where people over 65 are competing with younger people to get vaccine appointments. We, really need them to have as few barriers and as few obstacles as possible between them and their vaccine appointments. And if we open this up to teachers and people, who have comorbidities under 65, that will create some competition. And so they really are letting, like I said, their phases overlap in a lot of other ways, but they are trying to really make it rigid for these people who are 65 and older because they're most likely to pass away if they do contract the virus and because they can struggle with the appointment tools.
Have you heard of any plans of how they plan to get teachers vaccinated? Because I think that is a concern for a lot of people with kids or grandkids, getting them back into schools.
So as of right now, the state is already working with districts to set up pods, those points of dispensing sites for teachers over 65, bringing them into the district. And then it looks like they're going to be trying to partner with districts the way they did with hospitals to set up some of these sites and to help have the districts say, who should be prioritized. And hospitals, they got the chance to say, we really need these specific workers to have the first priority, but then we need these ones too. Hospital administrators know their own workforce a little bit better. And similarly, they're letting districts decide, who comes first, cafeteria workers or bus drivers, right? Or are they on the same plane? There's a lot of different staff and a lot of different employees within a school district that really need to be protected. And the officials within those districts will get some say on what those priorities are and how they're going to roll that out.
I wanted to throw you a community question that we got. And we kind of touched on the frustrations of like how fast that we saw, phase one happen. And then all of a sudden they're adding these 3 groups in, but then there's like, well, why haven't they added anything since? So I'll ask this question, how it was worded, but why did the state open phase 1 and add in some phase 2 groups so quickly, but they haven't added any others since?
Right. Yeah. So, it kind of just goes back to them really trying to lock it down around 65. I think the idea was healthcare workers know how the healthcare system works. So they're going to know how to get a vaccine if they need one. They were working with the hospitals. They're not the easiest group of people to vaccinate, right? They have wild schedules. If you know any nurses, there's night shift and middle of the night. And if you're working on an ambulance, for example, you might not be affiliated with a hospital. You're going all over the state. As we saw with hospitalizations being really high, people are being taken to Colorado and Texas. So of course, those ambulance drivers are hard to pin down. So not to say that healthcare workers were just so easy to vaccinate, but they do have a little bit less of a problem with these vaccine portals. And they do tend to be a little younger than those 65 and older. And so I think that they were just kind of saying, we need to prioritize them. We need to get them done. And we have to prioritize them because we need a healthcare workforce if we're in the middle of a pandemic, right? I wrote a little bit about Oklahoma was already in a physician shortage. It was already in a nursing shortage. Then the pandemic hits. Obviously, the demand is going up, but it hurt their supply too. People get sick. Or one of the biggest problems was nurses or others would be exposed out in the community and then they would have to quarantine and they couldn't work for 2 weeks. So they would have dozens of people quarantining, which would make their staff shortage even worse. So if you kind of put the kibosh on that, right, with the vaccines, that helps with your healthcare workforce. But again, I think that the belief was that it was a little bit easier for them to navigate this system than it would be for somebody 65 and older. So they didn't have to lock it down as much.
Yeah. I want to take it actually to a question from the chat that we got in. Thanks, Chelsea, for sending it my way. It's from Simon. Do we have any information about the effectiveness of the vaccines we are getting here in Oklahoma in terms of the COVID variants we are seeing emerge around the world?
So
go ahead.
That is a great question, Simon. So when it comes to the variants, I don't think there's been a ton of research on how Moderna and Pfizer will respond to those, but the belief, right, the faith is that it's good. We're hearing that because those variants have very similar symptoms, they present the same, they don't seem to be more lethal, they don't anything other than more transmissible, they don't seem to be too different. So the hope and the belief is that these vaccines will treat them in just the same way, that our successes in treating these viruses when people are infected will be the same. I have been reading the Johnson & Johnson vaccine is about in the 70% effective, but it was tested when the variants were out. So that is reflecting changes because of the variants. So it's probably more effective than it's really getting credit for because it's kind of playing in a tougher field than the Moderna and Pfizer vaccines were playing during their trials. We talk about that a little bit in a minute. Right now, we have two major vaccines. We have the Moderna and the Pfizer. Johnson & Johnson, sorry to jump the gun, Kateleigh. I know this is a question we ask a little bit later. But the Johnson & Johnson vaccine is expected to be reviewed by the FDA right at the end of February. And officials are hoping and expecting that we will start getting Johnson & Johnson vaccine doses in early March. And then that would obviously help our vaccine supply quite a bit. Some people have expressed concerns about it having a lower efficacy. Again, they were having to go through trials when we knew about variants, when we knew all this stuff was going on. So they had a harder test, first of all. And second of all, even with it being in the 70s, that's more effective than the flu vaccine. Some health officials said during one of our briefings that we're a little spoiled by Moderna and Pfizer. 95% is not normal. That's not where the benchmark should be. That's extremely high. So in the 70s is still higher than the flu vaccine. And the Johnson & Johnson vaccine is only one dose. So it would be really helpful for people who are kind of hard to track down. Health officials gave the example if they're going to be vaccinating people who are living in a homeless shelter, people who are kind of passing through a single dose regimen would be really helpful for them. It might be helpful for younger people who are likely to survive the vaccine or survive the virus if they were to contract it, who are probably going to be fine. And again, it's still a very effective vaccine, even if it seems like it's a bit lower.
Making sure I can see the chat. I just want to remind people that if they have questions as we're going, just to put it in that Q&A function so Catherine and I can hopefully get to it. So let's talk about, you know, how outpatient, smaller outpatient and primary care dental, how they're faring during the pandemic. What have you heard from some of those people?
Right. So I've been talking to the State Medical Association, the State Dental Association. For them, I think it was pretty tough at the beginning, like it was for all healthcare providers when we were in a PPE shortage and we weren't really sure how transmission was happening. And there weren't these best practices for this virus because this virus had never existed before, right? It was the novel coronavirus that made it pretty tough. But now we're a year in. And so what's happening is there's plenty of PPE. The Dental Association for Oklahoma is really trying to remind people, don't put off your cleanings, don't put off like some of your maintenance. Your dental health is very important to your overall health, and it is safe to go now. Dentists, the hygienists, they all have the PPE they need. They have best practices in place to keep you safe. So it is safe to go to the dentist. It is safe to go to the doctor for your, you know, your blood work and your checkup, all the stuff you need to do that is not related to the pandemic. That is all safe to do, and it's very important. Again, you need to protect your overall health more now than ever, right? And so taking care of your teeth, taking care of your just general health is really important, and it's safe to go.
We got another question from Simon, and I think this is something that a lot of people that are in college right now care about. So given what we know about the vaccine rollout, can we expect to be back to normal by fall For instance, OSU has already said they are planning for traditional in-person classes this fall. Is that realistic at this point?
So I guess it depends on whom you ask, right? We heard Dr. Fauci pretty recently say that that is not, that's not a wild hope, that could be reasonable, but that is going to take us behaving well. So what I'm hearing from a lot of medical experts right now is that that is an attainable goal if we all keep wearing our masks and we do the 3 Ws: wear your mask, wash your hands, watch your distance, and get the vaccine. We can't abandon the other precautionary measures, because we are going to reach this like conditional herd immunity, is what some immunologists are calling it. We are going to reach enough people getting vaccinated contingent on us still wearing masks, still washing our hands. So I guess that does change a little bit back to normal, right? Is it going to look like it did in 2014 and 2017? No. We still will have to be taking some measures, but I think it's not unreasonable to think that we'll start being able to see our friends again. We'll be able to start getting back to some idea of normal life. But to say like, will it just all be over and we can all pretend it never happened? I don't think that that would be the case by fall.
Yeah, I think we're all hoping for a better answer. We'll see, I suppose. But there's a question also from Shanley. She actually has a couple, so we can start. And this is something that we talk about all the time, Catherine. This is great that she's asking these questions. Okay, is the booster shot the same as the shot as the first one, or are they having to track two types of shots? It sounds like a nightmare.
That is a great question. And I get it all the time. They are the exact same thing, the exact same amount, the exact same medicine. They're like, you can use the same exact dose, to give somebody their first shot, their second shot. And so that gives states and other, people who are dispensing these shots a lot of flexibility. But that does create some concerns for people, right? How are you guys prioritizing first shots versus second shots? I think we got a question similar to this.
Yeah, about what was it that our second dose shots being withheld till supply increases. Right. That was the question that we got.
It's actually pretty close to the opposite of that. Oklahoma is really, really focusing on getting people their second shots. And so they will do that at the expense of people getting their first shots. We're hearing that from Deputy Commissioner of Health Keith Reed. We'll have weeks where vaccines are pretty much only going to people at their second shots. And that will mean fewer first shot appointments. But they're really wanting to make sure that people get them and get them quickly. And that kind of leads to another question that we got about whether they just go bad or become ineffective if you wait too long to get your second shot. That is not the case. So it is recommended that you get it 21 to 28 days after your first shot, depending on which brand you get. But that is, the recommendation. It is not the stipulation that it just goes bad on you if you don't get that. Another update that we got from Dr. Aaron Wendelboe is that if you follow immunology, it is very standard that your vaccine is going to be, your second dose of a vaccine will be good 6 months out. But this is how it was tested, right? So in the trials, this was, what they got approved for. It needs to be 21 days. But we don't have any trials where they have these specific vaccines and a test for a year, right? Because they didn't have that long. This is a novel coronavirus, right? And so what we're hearing is these, not that you should wait 6 months, but that you could, and that you don't have to start your regimen over if you miss your second dose appointment or, window, your preferred window by a few weeks or even a couple of months. Of course, you will have less immunity than when you get your second shot, as your first dose makes you about 50% immune, and then your second one brings you up into the 90s. You will obviously be at that kind of diminished immunity until you get your second shot. So obviously you want to get it pretty quick, but you're not going to have any kind of negative impacts if that shot, once you get your second shot, there won't be a difference in your immunity a few weeks out if it comes a little bit later.
Like the idea of starting over, right?
Right.
Not,
you don't have to start over. No matter when you get them, you're going to get 2 shots. You don't have to start over and get a third one. 2 shots is all it takes.
So the other one from Shanley that I think is pretty good, and I don't know if you've heard anything about this yet, Catherine, but we hear about discarded or unused doses in other states going to waste. Have you heard anything like that in Oklahoma? Should people go sit outside their neighborhood vax location at the end of the day to see if there are leftovers?
So I've actually gotten to write about both of these things. I was very lucky to do so. That is true. Other states have had to toss doses because they couldn't get them into arms before they went bad. And that happened in New York City. One of their city council members has been really railing against it. And he attributes that to these rigid phases. Because again, in Oklahoma, we are abandoning the phase if there's 30 doses and they're going to go bad in an hour, you're going to get them into arms. It doesn't matter, if somebody is in phase 1, 2, or not even in a phase. So that is why we haven't wasted any doses. We've heard of some getting, messed up on a very small scale, like a needle broke off into a vial on accident, something super small, but not wide scale, like 50 doses or 100 doses, anything like that. And that is because we have this fluidity to our phase approach. Should people go wait outside? No. We've been hearing a lot of complaints about that because a lot of places, if they do have an extra dose, they have a protocol in place. They have a phone tree. They have something in place. They're not just going to go outside with a megaphone and say, whoever wants one,
You're up. Yeah.
I mean, I would love if that was happening. Yeah. I'd probably go sit outside somewhere, but that's not how it's going down. So
it's not what's encouraged. I remember whenever I talked to a pharmacist for my story last week, or I guess it's airing this week, but they said that, since they've been having people call them to ask, hey, I'd rather get it through you guys because I trust you guys and I come here for my other medications and I'd rather get this here. She was telling me that how they're planning is they're going to schedule people, obviously, but then like if that person can't make it for some reason, maybe like, I don't know, like they're getting their car worked on and it just turned out to not be a good day for them. Like you're saying, like they're going to have like a waiting list, a backup list for them to call because, she was concerned that because I think they're planning on getting the Moderna vaccine, the pharmacies is what she said. But she was saying that, she does have concerns that, if people don't show up, that they might waste it. But the backup to that she hopes that will prevent that is having that waiting list that she can just call and be like, hey, we had a cancellation. Do you mind coming in like a day early or something like that? So that's something to keep in mind too. Especially as pharmacies hopefully get more vaccine besides this like kind of trial start. Let's see if we have some other community questions. I don't see any yet from any panelists. Let's go to, John Thompson. Oh, here we are. I'll read it because he has some article explanations in it. So I'll just read the whole thing. As the Washington Post explains, CDC researchers looked to Europe's experience in the fall to inform their conclusion that there has been little evidence that schools have contributed meaningfully to increased community transmission. But now European schools are closed, and with the new variant, they found that young people transmit as much or more than adults. Will the schools dare to reclose if predictions are correct and the variant becomes the norm?
So what I'm hearing, there's been a big study going around that schools were not a significant source of spread, that they are very safe. There has been a little bit of conversation about how that is contingent, again, kind of like conditional herd immunity, that is contingent on them being safe. And so Oklahoma does not have a uniform requirement of wearing masks in schools. They do not have a uniform requirement on any kind of particular social safety measures. Schools will also reflect what's going on in their community. And so communities with more precautionary measures tend to be safer within their schools because that is just a reflection of what's going on there. So yes, schools and places where spread is not very bad in the community will also be safe. But that requires effort. It's not just send your kids to school, nobody's wearing a mask, we're all sitting in a circle together and nothing happens. Obviously, I'm preaching to the choir here. I know everybody here knows that, but there's a grain of salt to be served with this concept that schools do not have a big source of spread. As far as the variants go, that is tough. We are seeing that children are more likely to transmit this variant. I would say Oklahoma, again, they are not having a very statewide approach to what schools are doing. They're not really having a statewide approach to what anybody's doing, but it's been very individualistic when it comes to districts. And that's been true of their mask mandates. That's been true of their closures. That's been true if they're doing A or B or A to B schedules online partially. It's been a patchwork. And I would assume that regardless of the situation, it will continue to be a patchwork if and when really the variants start spreading in Oklahoma. We'll just have to see what each individual school board and state or superintendent wants to do.
Yeah, I think during the last state meeting that, when someone had asked the question about, have we seen evidence of the variants? They had said something about like there was a lab at OSU that had they had done some studying and there was no significant presence of new variants in the COVID-19 virus that had been confirmed by that laboratory testing in Oklahoma. But they said we should assume that it's here. Right. Like just because we haven't tested and seen it yet, we should still assume that it's here.
It's in surrounding states and it's very transmissible, right? If something is in Texas, to think that it's not in Love County, Oklahoma is pretty silly probably. And it's not easy to do the sequencing that you need to do for broad scope testing of these new variants. There's some tech limitation, there's some workforce limitation. It's tough, right? So it's tough to catch it. It takes a lot of sample to do this sequencing and to do it broadly. So if it's here, it's not going to be detected super widely the same way. Just a sidebar, when we're talking about variants and testing, there's some concern over whether our existing coronavirus tests can catch these new variants. What I'm seeing is that PCR tests, the ones that go up and into your brain, the bad ones, they can still catch these new variants, but the easy, quick ones are less sensitive. But that's always been the case. Just my soapbox really quick. Those rapid tests have a lot of false negatives. They're not very sensitive. So to just depend on that by itself is not a very safe way to go. Depending on the type of test and where it's administered, there are false negative rates up to 70%. So saying, oh, I got a rapid test and it said no, so I'm good, it's not a good way to go. You should always follow it with the one that makes your eyes water and kind of makes you feel like you have plastic shoved up in your brain. That is always a good way to go, to have a PCR test in addition to a rapid test.
Not pleasant, but
yeah,
there you go. I'll take one for you to give you a little bit of the break. How many Oklahomans have received COVID-19 vaccinations? Well, as of Friday, this is what the state's put out. More than 100,000 Oklahomans have received both doses of the vaccine, completing the series. Oklahoma has administered over 500,000 vaccines, and over 40% of the 65 population have received the vaccine. I know that they're wanting that number to be like 2/3 or something. They said 2/3, like to maybe consider opening it up to another person, but we'll see what they do. I feel like they've said like 50% and then also said 2/3, and then they're like, then we'll start having the conversation of opening it up. But I don't know. I think we'll see for that. But I do want to say that data, they mentioned this several times on Friday, where it was like, this data that we're putting out about how many have been vaccinated, that's just through like the state system and where they're vaccinating through the state. They don't have the data from tribes or think they're still waiting on the data from like CVS and Walgreens for the LTC, the long-term care. So that's something to keep in mind. Like they say that this is underreporting, really, like the 100,000 that have received both. And then Oklahoma administering over 500,000, they're saying that's underreported.
And she didn't say anything wrong. I'm not correcting her, but the tribes are reporting, but they're doing their vaccination separately. Yeah. So Oklahoma, the state, is touting its vaccination numbers, the tribes are not included in that. They're doing a great job. There are a lot of people kind of mistakenly saying, hey, Oklahoma's numbers are so high because of the tribes. They are doing a good job of vaccinating, but those are two separate numbers.
Yeah, I think Keith Reed said that they're waiting to get the information from the tribes because they're reporting through the Indian Health Service. And they said that, I think that he said it's difficult to get just Oklahoma's numbers because they're like doing it. I can't remember what he said. I'm not going to say it because I can't remember exactly what he said, but they're having difficulties getting it from the federal government. And then I do want to say that the state is now averaging 9,500 shots per day. That's the latest numbers. And then we did get a question, speaking of tribes, we did get a question as well. How are tribes doing in their vaccination efforts? Like, you know, for example, are they required to follow the state's 4-phase plan, or can they do their own, or what do we know about that?
So truth be told, I haven't been covering the tribes as much. We have a full-time tribal reporter, Allison Herrera, who does great work. But she's been covering their, the tribes' vaccination plans and how they're going. So I'm not super clued in on that. And I don't want to speak out of turn and say something wrong.
Yes, no, absolutely. Yeah, I encourage people. She actually is working on several stories where, there's some tribes that are that prioritize for speakers, and then some people that are opening it up to it's like that there's some tribes that are doing like their own phased approaches, and then there's some that are doing what the state's doing. So it's good to check in with Allison because I know that she's covering that side. And if you go to our what we know about Oklahoma's vaccination plan, that is one element that we've highlighted that we're looking at is the tribal side of this whole story, which is a lot to report on. And so I think that's all we had planned for today. I don't know if there's any other questions maybe that we could get from some people before we end up here. I don't see any others.
It looks like Shanley has one more question about companies that are not associated with healthcare and other corporations wanting to vaccinate their own workers. It is looking like I've heard that conversation as well. They are not going to be getting that kind of supply for a while. I would imagine that when we're in phase 3 and we're doing essential workers, that is something the state would be partnering with these companies on. But I haven't heard any talk of that yet. It's kind of another thing that we know is going to happen, but we're not sure when, and we're not getting a lot of details on it yet. I know that's not a very satisfying answer.
Well, I think that I want to ask Catherine one question. What's like the couple things that you're watching with what we know about where it stands today? What's something that you're kind of watching and maybe looking for a future story?
Let's see. There's all kinds of stuff, right? I'm really just interested in more structural issues, right? So I'm really interested in how are we having the workforce to do all of this as we keep expanding. When I was writing about the coronavirus at the end of last year, I was hearing from all these health departments, county health departments saying we were already maxed out trying to do all of our STI prevention, teen pregnancy prevention, other public health things. You know, there's the annual concern about kids getting rabies from bats. I mean, they have the normal public health routines. Then you have flu season, which is right now. That's usually their crazy busy season. So they already have that. And then they have all of the coronavirus testing and surveillance and data work. And then now on top of that, they have vaccine work. And so like, how are we doing this? They were already stretched thin. So what kind of funding did they have? How are they bringing people in? I know we're using the Oklahoma Medical Reserve Corps. So what does that look like? What kind of people are volunteering? Mostly just like in a literal sense, how are we pulling this off?
Yeah, with like limited, we already have nurse shortage, and how are we adding just another thing to take care of? Yeah, I get what you're saying.
It just kind of keeps on coming for those
people.
So I'm really interested in that. And I'm really interested, as you all know, the legislative session started this month. And so I'm really interested to see what the legislature wants to do to help that. Are they going to try to increase funding or do any kind of special one-time funding? We haven't heard any plans of that. We're going to see, of course, Oklahoma's Medicaid expansion is going to go into effect this summer. I'm really interested about access to care among the Medicaid expansion population during the pandemic. There's kind of a lot of health news happening this year, regardless of the pandemic. So seeing how that affected a bunch of these other policies, I think is really interesting too. I know I'm not selling that very well. It doesn't sound interesting the way I'm explaining it, but I hope it will be.
I think it's
the
interesting.
stories that will come out in the coming weeks.
Oh, and we did get one last question. I think I saw. Have you heard anything of how veterans and their related health systems are faring with vaccines?
Yeah, so they were part of the CVS Walgreens program, and it was going so poorly, the state had to step in and do it instead. That was not very good, but they are catching up on that now. They were behind. And health officials even had to say in one of our briefings, we had to use our muscles and pull back on their allotment, do some of their vaccinations for them, and play hardball. And some of the people who missed out were people in these veteran centers, which is not great.
Well, thank you. And then I think that's it for us. And then now we're back to Jenny May.
It's me. Yes. Thank you, everyone, for attending. Thank you so much, Catherine and Kateleigh, for leading this discussion, a much needed discussion that's made possible because of members just like you who support this station, who support reporting that Kateleigh does, the reporting from StateImpact. It's all here because of your support. So thank you so much for making this possible today. We've recorded this event and we're going to share it with more people. So you're making this reporting possible for them. So we appreciate you. And we'll be back to talk about more important things in the future here at Inside KOSU. And we look forward to having each and every one of you as our guest in the future. So thank you, everyone, for joining us today. And we'll see you or hear you on the radio soon. Take care.